have you here. My name's Dr. Nigel Giam. I'm the lead GP Training Program Director for the St Mary's Scheme, and I'm Course Director for MentorMRCGP. I thought it might be useful to put a quick video together. You may be considering doing the final RCA sitting this coming September, or you may be thinking about doing the new SCA exam, which will come into play in the first week of November. I know it's a very, very challenging time, and actually it's very important that you make an informed choice and really start thinking about the exam that might be best suited for you. For those of you who are caught up in the RCA at the moment, you'll appreciate it's quite difficult because patients are not standardized, and specifically it takes a long time to get the right recording. But the SCA is also not going to be an easy exam. It's going to be very, very challenging given the fact that it's all going to be done remotely, mostly over video with some audio consultations. So let's just talk a bit about the exams in terms of both the RCA and the SCA, and hopefully you'll find this useful. So with regards to the RCA, the final sitting will be in September. The date is yet to be confirmed at this point in time, and you're going to need at least about 3 months to make sure that you get the right case selection. And when we talk about case selection, we are specifically talking about making sure your case not only has clinical challenge, but also has complicating factors. Now, one of the big reasons for failing the RCA is because of poor choice of consultation. So it's very, very important that you're still familiar with the RCA competencies, that actually part of the data gathering is actually sharing and case priming. So using the information that you already have in the patient's notes. This will also feature in the SCA when you look at the SCA marking competencies, which I'll be talking about in a second. So the RCA is an exam which is still something that you can control in a sense, because you can control what you submit. You still have time if you are recording from this point onwards to get the right case selection, and with the right strategy, which we can certainly help you on Mentor RCA Flagship. We can teach you to make sure that you're hitting all these RCA competencies. The RCA exam is also a little bit cheaper compared to the SCA, so cost is certainly always very, very important. At the moment, the RCA exam is £1,076. The SCA exam is about £100 more expensive at the present time. So when we start thinking about case selection, always start thinking in the RCA, not just about the clinical challenge, but also about the complicating factors to your case, which will be housed within the patient's agenda, whether it conflicts against your own, or whether there's a deeper psychosocial narrative which allows you to manage a situation as opposed to just a symptom. Now, when we think about the SCA, now these are all going to be standardized cases, and specifically 12 cases of 12 minutes in length with 3 minutes to read the case notes. Now, the majority of these are going to be over video with some over audio. They will involve not just patients, but also consultations with simulated actors who are playing allied healthcare professionals or third-party encounters with parents. The 3 domains remain much the same, but have been labeled slightly differently. So the data gathering now includes the diagnosis. The clinical management now includes also medical complexity, and the interpersonal domain has now been renamed relating to others. It is expected that the clinical management domain will carry a bit of extra weighting. We are yet to hear the details of this. Very similar to the RCA, there will be 4 grades awardable, and these will be translated into marks, again, the details of which we're going to find out shortly when the RCGP publish their update. The main thing to recognize, though, is that the SCA will also be a very challenging exam. There'll be a broader curriculum coverage. As you can see, we're going to be looking at 12 clinical experience groups, and so you need to be prepared to make sure that you are going to be comfortable dealing with essentially these sorts of areas. Typically in an RCA, we wouldn't really expect you to use follow-ups, for example, in terms of case selection. We will often now see this in the context of the SCA perhaps going through investigations or results. What's really, really interesting is how the mark sheet has changed for the SCA in terms of the marking competencies. So as you can see, there are a huge number of marking statements that are going to be looked at in all 3 domains: data gathering, clinical management with medical complexity, and relating to others. In the data gathering competency, just to draw your attention to competency 3, an effective use of existing information to assist in a safe assessment. So this again is very important when we're looking at the RCA in terms of case priming. This will also now feature in the SCA, how you use the information that you already have. If we look at the clinical management aspects, you can see that prescribing has been highlighted, that actually inappropriate untargeted investigations, if these are selected, then this will unfortunately compromise your mark in the context of the clinical management aspects, and if management options were unprioritized in regard to perceived risk. Relating to others, so again, some interesting statements that have been highlighted. Competency 3, judgmental in approach, the patient's autonomy was only partially considered. And then if we look specifically at negotiation skills, competency 12, we can expect to see consultations which will go well beyond just testing for your diagnostic skills, but really looking at your negotiation skills, how you work through dilemmas and challenges with patients. So we can help you. Whether it's the RCA in September, we've got RCA flagship courses that are going to be running over the summer. Do have a look at the website, MentorMRCGP for up-to-date details. We'll be running a free SCA webinar quite soon, so do register your interest by going through the contact page of the website, and do subscribe to our YouTube channel, MentorMRCGP. If you want to keep up to date, join our Facebook support group, and you can contact me also on Twitter.
So whether it's the RCA, the SCA, I can help you. Don't be scared to reach out, pick up the phone, drop me an email, click the link down below, and I look forward to hearing from you. All right, take care. Bye.